again. So good. Okay. All right. I'm here with Dr. Jerrod Brown, and we're gonna do the first of two parts about sleep problems and brain injury. And Jared, why don't you just take it away?
You bet. Well, Dan, thanks for having me back. Hope all of you are doing well. Again, my name is Jerrod Brown, and we're going to talk about sleep disturbances today in general. And then part two is about circadian rhythm misalignment. So, all has to do with sleep. And why do we want to care about the topic of sleep? Well, it's the number one thing to health, and it's probably one of the number one interventions for brain injury. So after a brain injury, you need to definitely make sure you get proper rest. Of course, many other variables are at play here. Here's a copy of my brief professional biography. I know I'll share my slides with Dan, so feel free to take a look at this if you have interest. But I'm a professor, do a lot of trainings for different groups, do quite a bit of publishing, and I do a lot of consultation on a variety of topics, including traumatic brain injury. These are some of my certifications and other credentials. Some of my certifications do relate to things related to the brain. And these are my graduate certificates and other professional certificates. One of my graduate certificates is in traumatic brain injuries. I have a graduate certificate in neuropsychology and another graduate certificate in neuroscience and the law. So I've studied brain injuries and other kinds of neurocognitive impairments for many, many years. These are my main areas of focus in terms of the trainings I do and the consultation work I do. And sleep disturbances is on this list, including head trauma. So we'll be talking about those two variables today. A few other topics on this list I'll weave into today's topic talk as well. So why do we want to care about the topic of sleep? Well, a third of our life we're sleeping. If you go by these numbers, we all know this, but it's just kind of interesting to visually show you. If you sleep 8 hours a day, that comes out to 56 hours a week, 240 hours a month, just under 3,000 hours a year. Now we know some people that sleep a lot less than this, and I know people that sleep 16 hours a day. So oversleeping can be bad, undersleeping can be bad. So you got to find that spot that's best for you. And that's difficult to say what that is. So working with your healthcare provider to try to determine that. So again, there's many reasons why we want to study the topic of sleep. We all know these things, but I'll share some things with all of you too that maybe you haven't thought about. But obviously, getting a good night of restorative sleep, we typically feel better the next day. Our brains work better. We can stay focused more. Our memory's better. We're usually happier, not always. Now, if you throw brain injury into this mix, it gets a little more complicated. But if you're someone living with a brain injury, I'd love to hear from you. If how does sleep impact you? The cases I've consulted on, I've heard numerous stories where someone's had a brain injury, and if they're not sleeping, it just is pouring fuel on the fire and making everything worse. Sleep influences our behavior, body sensations, our emotions, our thinking patterns. The list goes on and on and on. Now, here's a few things I put together that I've gone through hundreds and hundreds of articles on sleep over the years. I've given many talks on different dimensions of sleep. I am a certified sleep coach as well. I forgot to mention that in the beginning. Some of these things we know, definitely common sense, but maybe some of them we have not thought of. Getting a good night's sleep is related to improved creativity. It may serve as a means to help prevent certain kinds of cancer. It's a great way to lose weight. People are surprised to hear that. How does sleep and weight relate to one another? Well, chronic sleep deprivation drives up inflammation in our body. Our hormones are off. And if someone's trying to lose weight, if someone looks at it holistically, you really got to look at their sleep patterns as well. And the list goes on and on, but this comes from numerous studies. One other thing I will say that maybe some of you have not heard about in the last several years, I think it's probably been within the last decade or so, researchers found kind of like a plumbing system in our brain where if we get deep restorative sleep, it's getting rid of all that toxic chemical buildup through the day. So it's kind of flushing it out. Now, chronic sleep deprivation over many, many years, many decades, has been linked with more neurodegenerative disorders. Just type in sleep disturbances, sleep deprivation, and Alzheimer's disease. You'll have hundreds of things to read on that. Very interesting research and scary stuff too.
Can I ask a question that maybe you're going to get into in a second? Because
Sure.
it's interconnected with sleep is something that exists without brain injury, obviously, but with brain injury, there's a fatigue and there's a overwork, and there's a need both to deal with that fatigue, and then there's a need to heal out of this hole of the brain injury. And are you going to talk about those things at all? Because they're kind of interconnected, but not, especially the
Yeah,
fatigue. Yeah,
when I get to the TBI specific stuff, if I don't cover it, please interrupt me. Definitely ask questions. Let's go
great.
deeper into it. But
Thank you.
we know folks with TBIs, everyone's different, of course. But in my experience, going a full day without rest, not good. More naps are usually required, just slowing down, pausing, not multitasking is probably a good idea because that just wears the brain down faster. Sleep disorders in general, regardless if it's a TBI or not, are going to be very common, impacts people of all ages, significant cost to this. Why does this cost a lot of money? Lost productivity at work, car accidents, domestic violence goes up. There's a whole line of research on sleep deprivation and domestic violence, really interesting stuff. Sleep disorders are often misunderstood and a lot of times underdiagnosed, where you go to maybe a mental health provider or sleep or to your medical doctor. Do they focus on sleep a lot? Not a lot, to be honest with you. Sleep dysfunctions are all over the map. There's so many sleep disorders out there. I think there's like close to 88 different kinds of sleep disorders or more. The most common one's going to be insomnia and sleep apnea and restless leg syndrome and a few others. But regardless of the specific diagnosis, these are some different dysfunctions that we need to be aware of as it relates to sleep. So irregular sleep schedules, we'll go a lot deeper into that in part two with circadian rhythm. If someone works the overnight shift or works shift jobs where they're on the same schedule for a few weeks and then they flip schedules the next few weeks, that's really tricky. Nightmares, people with TBI have higher incidence of post-traumatic stress disorder. Not always. Daytime fatigue, Dan, definitely kind of alluding to what you were saying. Some people might have anxiety about going to bed at night. Maybe some people are very light sleepers. The slightest noise just wakes them up. Sensations in your legs at night or your arms, lots of excessive movement as you're trying to fall asleep or during sleep that wakes you up, or how it impacts the bed partner. Insomnia is going to be the most common sleep complaint and sleep disorder. Insomnia co-occurs with so many things, including much higher incidence of insomnia among people that have been impacted by brain injuries. So without a doubt, chronic insomnia over a long period of time diminishes our overall quality of life. It impacts all facets of our health and wellness and functioning. There's many dimensions to insomnia. This is a small snapshot. There's initial insomnia where someone has a hard time kind of falling asleep. There's fragmented sleep where they wake up a lot. It's difficulty just staying asleep. The night anxiety is a component of this. And then just being an overall light sleeper. These are some different dimensions of somnia that you need to be aware of. Most folks with medical health issues, neurocognitive impairments, mental health challenges, even substance misuse are going to be dealing with higher incidence of insomnia. Every human being probably has dealt with insomnia at some point, some more than others. Daytime symptoms of insomnia, needless to say, if you're not sleeping good at night, a lot of times you can be more moody, more irritable, more snappy with people in some cases. Daytime fatigue, reduced interest where it can really zap our motivation. So goal achievement can get in the way of things. It can really get in the way of leisure activities, parenting, driving, relationships, the list goes on. Here's a long list, but this is not an all-encompassing list. Insomnia symptoms can increase anxiety. It can make our memory a lot worse. Absolutely, it plays a role in depression, and depression plays a role in insomnia, so they work off each other. And the list goes on and on and on. So these are just some different symptoms to be aware of. And again, you'll have my slides from Dan, so you don't have to take notes here if you don't want to. You'll have these exact slides. Trauma, again, I do a lot of work in the area of trauma. One of the programs I run as a professor is all about trauma. We do talk about sleep in that program a lot. We know that trauma is very common among people in general, but having a brain injury in and of itself is a traumatic experience, which could contribute to full-blown post-traumatic stress disorder among some people, especially if the TBI was the result of like a violent crime or a serious car accident or something on that nature. So sleep disturbances and trauma go hand in hand. Go ahead, Dan.
I always throw in the PTSD from once you've had a brain injury and you're in a life where you can't do what you need to do, the supports start to fall out. There's a certain downward spiral, and that has its own PTSD. I've met many people like that. Um,
It can definitely amplify trauma symptoms. It's definitely difficult, no doubt about it. And a great way to combat trauma, get good sleep. One of the worst things that we can do for trauma recovery is not get good sleep. And trauma and sleep go hand in hand. So you might have more nightmares. You might have more fatigue. Anxiety goes up. What happens if the person is stress eating, smoking cigarettes, abusing sugar, caffeine, maybe using drugs or alcohol on top of that? It just makes everything more challenging. Sleep issues in young children oftentimes aren't diagnosed or considered, where that child a lot of times may get labeled as a problem child in some cases or have some sort of disruptive behavioral pattern. In some of these cases, if you peel back the layers, they could be dealing with untreated sleep disorder. So definitely screen for this, be aware of this. The more education we can have in the healthcare arena about this is going to be very helpful. Again, this can relate to all ages, but this is just some studies about what happens in adulthood through a cognitive neuroscience lens. Sleep deprivation in and of itself can adversely impact executive function and capabilities. We know pretty much everyone with a traumatic brain injury is probably going to be dealing with some level of executive dysfunction, which could be time management problems or planning deficits or organizational problems. Those are all executive function impairments. Sleep deprivation is just pouring gasoline on that fire and making everything worse. Some other things to think about when we're dealing with sleep loss. I mean, there are just tens of thousands of studies been published on sleep over the last multiple centuries and stuff, but it can impact our processing speed. It can contribute to more concentration issues, and the list goes on. Now, if you've studied brain injuries or you live with a brain injury, you know that a lot of these things are very common too among people with brain injuries. Other things to consider, it can drive the bus with internalizing problems. So those are symptoms experienced inwardly, depression, anxiety. It could play a role in increasing self-criticism or perfectionistic behavior. People that deal with some of these things, have they ever been screened for a sleep issue? Could it be a factor driving that bus? For some people, yes. Not always, of course. There's other layers to take into account. So when we think about sleep deprivation, again, this first section's all kind of given a broad spectrum overview. You can have physical health issues that get exacerbated. It definitely plays a role in high blood pressure in some cases. It impacts the brain health, and it can adversely impact our mental health, to name a few. In case any of you are interested in the DSM-5, just did a keyword search. This is from a while ago. The topic or the word insomnia comes up in the DSM-5 280 times, the word sleep a little over 1,800 times. You compare that to anxiety, 1,200, depression, 238, alcohol. This doesn't mean anything in and of itself other than the topic of sleep comes up frequently in the DSM, which is the Diagnostic and Statistical Manual for Mental Health Disorders. So most mental health disorders, higher rates of sleep issues are going to be more common. Dan, I'll stop there before we get into this next section.
I don't have any questions. I'm excited for this next section because I heard a brain injured person use a term one time, how other people are sleep privileged. And there's a host of brain injury problems underneath it. Like what you just described as the normal sleep problems or the unbrain injured sleep problems. So yeah, let's get into this part.
Everything I spoke about in that last section can be applied to this. It just makes it even more intense when we're talking brain injuries. So this is a slide I think I've shown in other talks I've done for you, but the symptoms of brain injuries are many and varied. And if you look at the most common symptoms of a traumatic brain injury, under that umbrella is going to be changes in sleep patterns. The overwhelming majority of people with a traumatic brain injury are going to be dealing with some level of insomnia at some point, some more than others. And there's a variety of reasons for that. Some of the reasons include the severity of the brain injury, the location of the injury. Was it an individual that's had multiple head injuries over a long period of time? What's the recovery process like? Is someone after the brain injury not taking care of themselves? They're not eating healthy. They don't have good family support. They don't take their medications. They're not exercising ever. They smoke cigarettes. The list goes on. That just makes this worse and worse and worse. Sleep disturbances associated with traumatic brain injury are all over the map. Insomnia, hypersomnia, obstructive sleep apnea is more common, periodic limb movement disorders, narcolepsy, snoring is increased, nightmares, the list goes on. So there's many different kinds of sleep disturbances that have been noted in the TBI literature to be much more common. So in an ideal world, everybody with a traumatic brain injury would get screened for this and assessed and work with a provider if they do have this who's sleep informed on top of the other providers they have. In the TBI literature, it talks about post traumatic brain injury insomnia. So after the TBI, these are some of the symptoms as it relates to insomnia that have been noted to be much more common. Again, when you study research, you know it doesn't apply to every single person perfectly, so everyone is different. Daytime fatigue is going to be more common. It can get in the way of work performance. It makes memory worse. Our mood is not as stable. Greater functional disability. So think of it getting in the way of daytime behaviors. Adaptive functioning could be cooking, cleaning, money management, transportation, all of these things. It can have significant caregiver burden if that person is living with other family members. It could play a role in greater sexual dysfunction. Could be something to consider with relationship dynamics. So working with someone who understands that can be very, very helpful. And the list goes on and on and on. On top of this, we need to consider the topic of chronic pain. A lot of people with traumatic brain injuries are going to be dealing with pain related issues. Increases in headache and migraine are reported. If someone had a brain injury, that doesn't mean just their brain was impacted in a lot of cases. Was their body injured as well? And now they're dealing with joint pain, back pain, or whatever kind of pain it is. If you've ever dealt with any kind of pain, you know you're probably not getting a good night's sleep, especially if it's chronic pain. So, traumatic brain injury, chronic pain, and sleep issues frequently co-occur. So on top of working with a sleep specialist, in a lot of cases, it's really helpful to work with a pain specialist. Could be a medical doctor, could be a pain psychologist, it could be a physical rehab specialist. Someone has a brain injury, they're dealing with chronic insomnia. At a biochemical level, it can throw off our hormones. So when you see this term endocrine abnormalities, your hormones are off. Your HPA axis isn't probably working properly. That's the hypothalamus pituitary adrenal axis. It can impact our gut health. There's a big connection between the gut and brain, the gut brain axis. Just type in traumatic brain injury in the gut brain axis. You will find numerous studies on that as well. You want to help the brain heal, fix the gut as well. Optimize gut health functioning. So important. Dan, before I get to the second section,
Interconnectivity, yeah, that interconnectivity is super important. And in addition to the HPA and hormonal regulation, I think maybe we'll get to this in the circadian rhythm, but the wake sleep cycles just sometimes don't work. Like you can't turn off. It's quite a strange state. Um,
definitely we will absolutely cover that in the circadian rhythm. So when you think of screening, think of just red flag indicators. If you're a professional or even a caregiver, just different things to be aware. But I throw the slide up just for us to be aware of. According to research, these are the big reasons why people go to their healthcare provider. Daytime fatigue, pain issues, digestive health problems, and sleep disturbances. A lot of times people with TBI are dealing with all four of these issues. But how often does a healthcare provider really ask questions about a brain injury? I don't think a lot if we believe the research. Looking at her sleep history, so just some things to consider. If somebody is dealing with a lot of these things on here, work with your healthcare provider. Snoring obviously is an issue. So if someone has a traumatic brain injury, you could have a couple things going on. The part of their brain that's related to the sleep-wake cycle, respiration could be partially damaged, which could contribute to more snoring. Maybe someone had a brain injury and they broke some bones in their face. That in and of itself would contribute to more obstruction. So someone might have a higher incident of obstructive sleep apnea. Very important to work with your healthcare provider on those things. Medical history, again, the more medical health problems someone's dealing with when it's untreated, they're likely dealing with more sleep issues. What about past surgeries? How does that come into play here? Well, I've known people that have had multiple surgeries, and some of those surgeries have left them with dealing with more pain-related issues. What kind of medications is the person on? There's a lot of medications that can impact sleep. Alcohol use, drug use, chronic weight gain can impact sleep. Trauma, as we talked about, if in the household other people are dealing with sleep issues, that can be a factor in some cases. So if the person's bed partner has a sleep issue and they're constantly up and down, that's a factor. Excessive screen time exposure, sensory processing issues, auditory processing. So there's so many different layers to this. So if someone's dealing with auditory processing, sensory processing, they may be hypersensitive to a lot of sound. Some people may be very hypersensitive to certain smells too. So think about this. And we don't think about this a lot, but maybe someone with a brain injury is very sensitive to certain smells, cologne, perfume, incense. Maybe someone is washing their bed sheets and something that smells really good to most people, but someone with a brain injury, those perfumes can be overwhelming, and that could contribute to more sleep issues. What our parents do if someone's younger, parenting styles, cultural factors, how many people are in the household, what kind of family stress is going on. If someone works way too much and they're up all night trying to meet deadlines, there's lots of kids, That's stressful. Too much napping can throw off our sleep. For a person with brain injury, I don't know what the right answer is to that. Dan, maybe you do. I'm asked that a lot. Like, should I take a 10-minute nap? Should I sleep for 2 hours? It's tough to know. Everyone's brain's wired differently. Any thoughts on that, Dan?
Yeah, and with napping as per brain injury needs, I found it basically, so long story short, you have these problems and these limits, and if you hit the limit, then you get into the fatigue more than just a brain fog, a real exhausting fatigue. And so my game became learning where the limit was and then trying to go 60 to 80% there. That's when a 10-minute nap, that's when I actually found exercise to be more restorative and sustainable for the long run. But sometimes, like after lunch, there was a need for a nap there. So the nap is towards preventing the fatigue within that effort, but you have to have the term now is sleep pressure, a buildup of being tired. And you don't want to sleep too much during the day because otherwise you don't sleep at night. And so it's a real crazy balancing act. And the other, since you're talking about noise, certain noises would wake me up and it would just be killer. Dishes clanking, sharp noises would just wake me up from anything, and it drove me crazy for years. Other
Earplugs
noises
help or
wouldn't.
white noise machines?
White noise machine plus earplugs, but you have to put the earplugs in a way that you don't hear your own pulse, because then that'll wake you up. And it is a
Yep.
balancing act. That this is like years of figuring it out. So yeah, it's a multi-connected thing. But yeah, the napping too much to get rid of your sleep pressure isn't good, but you need to do it for the restorative effect. So that's my answer. That's my experience.
Thank you. Thank you. Very helpful. So if someone went into like a healthcare provider who's not necessarily an expert in sleep, they could still look at these screening tools. These are some very well validated screening tools that have been used in countless studies. So you can Google some of these and find them right online. The Insomnia Severity Index, the Pittsburgh Sleep Quality Index. I have those on my desktop. I mean, they're quick, easy screening tools. Very interesting. Just I would Google them and look at some of the questions on there. When you're interviewing someone who's sleep deprived, and this is more toward the professional, the chronic sleep loss in that person you're interviewing, that person may be more uncertain about the question you're asking. It could also get in the way of their coping strategies, and they may be more careless and reckless in what they share with you. So it could, in some cases, lead to a misdiagnosis or an underdiagnosis. So definitely something to consider as well. Sleep has profound implications for cognitive brain-based functioning, intellectual functioning, attention, concentration, alertness, hand-eye coordination, problem solving, and memory. Chronic sleep deprivation makes all of these worse. A traumatic brain injury likely impacts many of these things as well. Depression is very common among people with a brain injury for a variety of reasons. This is what the research says about traumatic brain injury in conjunction with depression. People with higher incidence of depression are way more likely to have insomnia, and people with insomnia are way more likely to be dealing with depression. So understanding all of these interconnected topics going to be helpful as well. And what I've seen too, and countless cases I've been involved with, someone has a brain injury, they're chronically sleep deprived, or maybe they're not thinking clearly in some cases, and it could, in some cases, contribute to more unhelpful thinking styles. So somebody that has a lot of these unhelpful thinking styles going on, a great way to calm that down and get the brain to calm down is to get better sleep. It may not cure these things because some of these things could be rooted in trauma or attachment issues or just really bad learned behavior. But a good night's sleep can definitely calm the brain down, especially like rumination. If someone has a tendency to ruminate and obsess over and over and over again, good sleep can calm that down. Sleep deprivation in and of itself can adversely impact social connection. So somebody who's chronically sleep deprived over a long period of time it can really get in the way of their motivation to want to be around other people. So it could be a potential driver for social loneliness and isolation. And we know that TBI can impact social connectedness in some cases, and it can have an impact on social skill functioning, depending on a variety of factors too. If somebody is married or in any kind of relationship, and one or both of the partners is dealing with chronic sleep issues, I'm not talking a night here and there, but it goes on and on and on. It's been linked with more marital dissatisfaction. There have been studies on all of these variables here. So insomnia can contribute to more relationship conflict. One partner snoring constantly, that can get in the way. Mismatched schedules. So one partner likes to sleep and go to bed at 10 o'clock at night and get up at 6. Maybe the other partner doesn't come to bed till 2 in the morning and sleeps till 10. Those differences in schedules can be very, very tricky. What happens if one partner has restless leg syndrome and they're kicking the other partner in the night? Or one partner smokes. One partner wants a pet in the bed with them, the other partner doesn't. And maybe one partner has a tendency to love to be on their gadgets all night long in the bed, and the other partner's trying to get a good night's sleep. So we need to look at this from a relationship standpoint as well. The more of these going on too, sleep issues are often exacerbated. And if you're like a counselor, therapist, or you're just someone that wants to get a handle on maybe some problematic coping strategies, focus on getting good sleep on top of the other modalities. So problematic coping strategies could be somebody using drugs. It could be someone with anger control issues. It could be someone that is just so impulsive and interrupts people constantly and talks over them. So there's a million kinds of problematic coping strategies to be aware of. Where we live has a lot to do with this too. If someone has a brain injury and they're living in a very chaotic housing environment or they're homeless, they're not getting good sleep probably, and that's terrible for recovery. So looking at this too, where does the person live? And do they feel calm in that environment? Do they feel safe? Is it an environment that has just so many people in that household or apartment and it's just so loud and noisy and everyone's coming and going? No one can get a good night's sleep. There's no privacy. Not good for sleep, and it's sure not good for brain injury recovery. Couple things, I'm getting in the weeds here, but just to throw a few things out, that really interesting stuff too. Maybe someone lives in a really rundown old house where there's a lot of mold. Maybe they've had a lot of floods. Mold is very common. Mold and sleep go hand in hand. A lot of mold equals probably more sleep issues. Mold is a big topic that's related to a lot of not so good things, but just something to think about as well. The gut microbiome and sleep go hand in hand. So again, this relates to the gut-brain axis. The healthier the gut is, it can help us get a better night's sleep. And it's another modality to consider when we're thinking about brain injury recovery. If someone is smoking cigarettes, that has been linked with more sleep issues. I am I do a lot of work in the area of tobacco cessation, and it's a big issue. And sometimes I get pushback on this, but if somebody is trying to stay sober and they're still smoking cigarettes, it could contribute to relapse. Tobacco smoke can increase mental health problems as well. It throws off the gut. So helping people quit smoking, very important. What we eat has a lot to do with this. So if someone has a tendency to drink a lot of sugar sweetened beverages, energy drinks, they eat a lot of candy or a lot of sugar, they don't have a lot of vegetables or fruits, they eat tons of fried fatty foods. Maybe it's gas station food or it's something through the drive-through at a fast food joint. If that person has a tendency to skip breakfast frequently, and if they have a inadequate intake of zinc and vitamin C and fiber, and there's a whole bunch of other stuff, these dietary patterns have been linked with more insomnia. A lot of interesting research, Dan. I'm sure you're aware of this on nutritional interventions for traumatic brain injury recovery. Maybe that'd be something we could do in the future.
I see nutrition, sleep, I guess sleep and rest, and exercise and activity, and I've added the social interaction so that you have validation of what you're dealing with. Those have this foundational importance, and if you mess them up, it's like just makes things so much worse. I group those things in a similar way. They're
You
not,
might
yeah.
you might do well looking at the 6 pillars of lifestyle medicine. You mentioned 4 of the 6 pillars. I love lifestyle medicine interventions.
What are
It
the
would
other two?
also, I think it's quitting smoke or avoiding smoking, alcohol, and then I think the other one, though I thought it was be aware of the screen time exposure as well.
Hmm.
Yeah. So this next section, tips, strategies, solutions. So one of the primary interventions is sleep hygiene practices. And that's really looking at a variety of things, what we eat during the day, what we're drinking, fluid consumption wise. Are we drinking pop all day long? Even having too much water needs to be looked at. If someone's drinking a ton of water right before bed, they're probably waking up several times a night. What's going on in the bedroom is a factor. Is the pillow comfortable? Is it too hot? Is it too cold? Too much noise? Too much exercise during the day or right before bed can be not good as well. What are our thoughts and our behaviors about sleep? Sleep hygiene practices, very important intervention. This is in the general literature. Sleep improvement strategies can be applied to most of us. Getting up and going to bed at the same time every day is going to be helpful. We'll talk about that in part 2 even more. Naps only when age appropriate. Now, this is where it differs from the TBI literature. So, this is general. So, be aware naps for people with TBIs probably are needed in a lot of cases.
And
Like,
as we were talking about that before, I just wanted to mention the fact that there's an evolution and change with brain injury. I'm sure you're familiar with when you just got your injury or in the months that follow, there can be an excessive need, or you just can't even function at a certain point if you get hit with the absolute fatigue. So that napping time versus a year or years out, and in those years or years out, I've noticed, and I think it's like I know I injured certain aspects of cognition. I know I injured certain aspects of well, I had double vision, and as soon as those symptoms are active, basically, those are my core brain injury problems. That's when I needed the nap, right? I needed to not be there, is what I needed to do. But the nap juggling is different in the first few weeks versus year or so out.
excellent reminder. Definitely. Look at the environment again. Heavy meals before bed, not good. Too much caffeine, too much sugar before bed, and even in the afternoon or really any time of the day, too much of that's not good. Try to avoid things that are really stressful right before bed. So, for example, right up till bed, are you watching a really violent movie that's just revving up your system? Get off the screen before bed, ideally a few hours before bed. Get outside more, especially in the morning, natural sunlight. We'll talk about that in part 2 with circadian alignment. Now, I'm not going out and telling you guys to go do yoga, but this is what the research says. Make sure you're okay doing this with your healthcare provider. But yoga is medicine without a doubt. And there's many types of yoga, but yoga is so good for sleep. And there are some studies on yoga and TBI, no doubt about it. But again, talk to your healthcare provider before going out and doing something like that. Looking at the physiological benefits of yoga. So why is yoga so good for the body? Well, it can help calm the nervous system. It's regulating, it's calming the breathing, it slows the mind down. It can help people manage headaches more effectively, pain, sleep issues, hypertension, heart disease, asthma, diabetes. It's good for addiction, good for mental health. The list goes on and on and on. Deep breathing is really good. I can't think of any side effects from doing deep breathing, but that activates the parasympathetic nervous system, which is calming. It can play a role in detoxification of the body, gets our heart rate down, can play a role in lowering blood pressure. It's a great medicine for anxiety and stress. It can even play a role in helping with gut health. So deep breathing exercises, there's all kinds of them you can find online. Neuroplasticity, I know Dan, you and I are doing a training on that coming up, and it's a huge topic in the TBI world. It's a huge topic outside of the TBI world. How do we strengthen neuroplasticity? Well, getting good sleep is a critical component of it. What are some other ways to enhance neuroplasticity? Meditation has been shown to promote neuroplasticity. Cognitive training. So you're working with like a therapist who has training credentials in different cognitive training exercises. Exercise, sleep, managing stress, being around positive people, so social connection, eating healthy, cognitive behavioral therapy can help. Even gratitude, waking up every morning, maybe things are tough for you, but trying to find just something that you're thankful for, having that mindset of thankfulness, hopefulness, even joy, creating that sense of joy can be really good for neuroplasticity and neurofeedback as well. This is not an all-encompassing list. These are just some of the things that are good for our brain. Again, I'm not telling you what to eat, but just pointing out a few things. A plant-based diet, according to this study, was good for sleep. Me personally, I love the Mediterranean diet. That is rated the #1 diet in the world in terms of health benefits, but talk to your healthcare provider, a nutritionist. There's so many factors that come into play with dietary patterns and things like that. Here's what some of the research says specific about sleep hygiene practices within the context of brain injuries. And most of it is similar to the general literature. But anything we can do to improve the nighttime sleep environment, so really making the bedroom calm and comforting and cozy. The research says get technology out of the bedroom. Keep it as a calm, safe place. Increase your daytime activation. So if someone's laying around all the time during the day, that in and of itself makes sleep worse at night. So getting the proper amount of movement, enhance circadian stimuli. So basically, when you're getting up in the morning, the research says get outside if you can, even if it's for a few minutes, and try to get some natural sunlight. Consistent daytime schedules, consistent nighttime schedules, 30 minutes of blue light therapy in the morning. Talk to your doctor about that because for some people, that may not be helpful if they're dealing with some sort of vision issues or some other things going on in the brain. And no caffeine intake after 12 p.m., this research says. So if you like your coffee, that's great, but keep it at a cup if possible. If you like your energy drinks, what I will say, try to quit that. They're just not they're not good for human health. Dan, that's all I got. That's a small overview, but we'll go deeper in the weeds, I promise, with part two and stuff. But sleep's probably one of the most well-researched topics of them all out there. So there's tens of thousands of studies on these topics.
That was great, Jared. Thank you. And I can't stress enough the brain injury group. This what you presented can be interpreted as everyone talks about sleep, but with the brain injury group, I had the circadian rhythm misalignment flipped 100%. It was crazy. It made life very difficult for years, and the hearing sensitivity. And then there's all the brain injury problems, and then the anxiety. And then I would end up trying to talk to people, and they just talk about the anxiety. And yes, the anxiety exists, but there's all these other factors underneath too. And so what you described is good, and just emphasizing that that's what those other factors are there with brain injury. And yeah, I look forward to the discussion. People will record. I'll just play this, and I'll record that, and then I'll put that out. So I think this is great.
Great. Thank you, Dan, for having me back, my friend.
So I think if you make me or I guess it doesn't matter if you turn it off. it should just send me the recording. So okay, all right, and we'll do the next two. You'll be there, right?
Yes, as
Yeah,
far as
April
I
and the
know.
May.
Yeah,
Yeah,
I don't think I'm doing jury duty any
great,
that
great.
long.
Thank you. Yeah, thanks again. I know this is a lot of time and a lot of content, but I appreciate it. I got a great interview. Do you know Jamie Mo Crazy?
No, no, I don't.
She is a like pro skier, X Games. It's probably Olympic level. I don't know, but she had a severe brain injury and a really crazy long recovery. And in my experience, I've only spoken to about four and only recorded with three, including her, where they can talk about basically all the stuff I was telling you about the neuroplasticity, how hard it is, the gruelingness of it, and everything she said. I'm like, is on point. Is on point. And I've only, yeah, like I said, I can't find people like her to talk about that, but she was very open. So it's an excellent interview. I'm gonna put it out on my podcast series next week, and I'll probably use some quotes from it for that neuroplasticity talk. I mean, she makes the
Oh, awesome,
points.
awesome.
Yeah.
Yes,
All right.
send me a link to it. Love to check it out, my friend.
Yeah. I'll send it out. And she, she's a big advocate. She's doing brain injury stuff. She has a podcast as well. She's doing legislative work, and she's a pretty remarkable person. All right. Thank you, Jer. To be
Have a good
continued.
weekend. Reach
You
out
too.
anytime
Thanks.
if you need anything.
Thanks. Yes.
You bet.
Thank you.